Let us discuss more details of trigeminal now. And the ganglion giving 3 branches. Trigeminal ganglion, yes. Can you tell me who is supplying the skin on the forehead and the tip of the nose? Forehead and tip of the nose, the skin is supplied by ophthalmic branch of trigeminal, 5-1. There came a question, it is asking, there are some vesicles on the tip of the nose. Herpes zoster, which nerve involved? If you have some vesicles at the tip of the nose, herpes zoster, then I know which nerve. Yeah, which one? If there are some vesicles at the tip of the nose, herpes zoster, then it must be the involvement of ophthalmic trigeminal, because it supplies the tip of the nose and also the forehead. And what about the skin on the maxilla bone and lower eyelid? If you say lower eyelid and the skin on the maxilla and upper lip and lower eyelid and skin on the maxilla bone is of course maxillary nerve. What is maxillary nerve? It is the 5-2. 5-2 means the second division of the trigeminal. Yes. So that is the second division of trigeminal, maxillary nerve, supplying the maxilla bone, skin over that. Then who is supplying the skin on the mandible? Skin on the mandible is mandibular nerve, branch of trigeminal, but except the angle. So who is supplying the angle then? Angle we will discuss later, but it is not trigeminal. So angle you will discuss later, but it is not trigeminal. No, skin at the angle of mandible is not trigeminal. It is some other nerve which we have to discuss. Okay, we'll wait for some time. Yes, but this is skin on the mandible, and that skin on the mandible is supplied by mandibular nerve, branch of trigeminal. Now this is the deeper diagram. You mean to say going deeper into the skull? Yes. To see this is the trigeminal ganglion giving 3 branches. What are the 3 branches it is giving? 5, 1, 2, 3. And what is 5, 1, 2, 3? What is 5, 1? 5, 1 is the ophthalmic nerve, branch of trigeminal nerve, itself giving 3 branches, which will be passing superior orbital fissure to enter the orbit. They are sensory nerves. You know which is the most lateral? The lacrimal. And which is in the middle? The frontal. And which is the most medial? The nasociliary nerve. Nasociliary nerve will be associated with one ganglion in the orbit, the ciliary ganglion. Let us talk about the ciliary ganglion in the orbit then. You are telling that this is ophthalmic branch of trigeminal giving 3 sensory branches to pass the superior orbital fissure to enter the orbit. Yes, most lateral is lacrimal, in the middle is frontal, and most medial is nasociliary. Nasociliary is related with this ganglion topographically. What is that? Topographically. What is topographically? Anatomically. You remember TT? What is TT? Topographic nerve is trigeminal to carry postganglionic fiber, if you remember. So telling TT is a trigeminal topographic nerve. Yes. Carrying postganglionic fiber. Yes. Then who is carrying the preganglionic fiber? If you say ciliary ganglion, postganglionic fibers are carried by trigeminal nerve, then who is carrying the preganglionic fiber? Do you remember which is the functional nerve for ciliary ganglion? Yes, oculomotor. When you say oculomotor nerve is coming from Edinger-Westphal nucleus. So Edinger-Westphal nucleus will send the preganglionic fiber into a functional nerve which is oculomotor, synapsing in the ciliary ganglion, and then postganglionic fiber carried by branches of trigeminal to supply 2 muscles in the eyeball. Which 2 muscles in the eyeball? They are the ciliaris to increase the lens convexity, and then there is the sphincter pupillae to cause miosis, the light reflex and accommodation reflex. If you remember, Edinger-Westphal nucleus is sending preganglionic fiber by the oculomotor nerve, which is the functional nerve, and bringing the fibers towards the ciliary ganglion in the orbit, so that postganglionic fibers are carried by trigeminal to control 2 muscles in the eyeball, namely ciliaris to increase the lens convexity, accommodation reflex, and the sphincter pupillae to cause miosis, light reflex. It's a repeat information, in fact. Now, let us look at the 5-2, which is maxillary nerve to supply the bone maxilla. But before it supply the bone maxilla, it has to pass through foramen rotundum. And after passing through foramen rotundum, it will be supplying the maxilla bone. But there is a fossa, and in the fossa there's a ganglion. So you are talking about pterygopalatine ganglion in the pterygopalatine fossa? Yes. Now this pterygopalatine ganglion in the pterygopalatine fossa is supplying 3 glands, if you remember. LNP gland. LNP gland. Do you remember? What is L for? L for lacrimal. And what is N for? Nasal. And what is P for? Palatine. So you're telling L for lacrimal, yes. N for nasal, yes. P for palatine, yes. I think lacrimal, nasal, and palatine gland are controlled by facial nerve. Yes, it is facial nerve, but facial nerve via the ganglion, pterygopalatine ganglion. Can you tell me which nerve is functional nerve for pterygopalatine ganglion? Facial, because it will carry the preganglionic. And which nerve is topographic? Of course, the maxillary nerve branch of trigeminal. So maxillary nerve branch of trigeminal nerve is topographically related with the pterygopalatine ganglion to carry the postganglionic fiber and supply the LNP gland. Yes, remember, preganglionic fiber is facial nerve. Maybe nerve number 3 or maybe nerve number 7, 9, 10. They all carry only preganglionic fiber. They are all white in color, myelinated. Do you remember that? Nerve number 3, 7, 9, 10 are all preganglionic fiber. They are white in color. They cannot carry postganglionic fiber. So we're telling that pterygopalatine ganglion facial nerve is functional. Yes, and topographic trigeminal. Now, as you see, maxillary nerve is passing inferior orbital fissure, become inferior orbital nerve and run at the floor of the orbit. The maxillary nerve is passing inferior orbital fissure to become inferior orbital nerve and run at the floor of the orbit. When it is running on the floor of the orbit, it will send branches to the upper teeth and carry the pain of upper teeth. It is also carrying the pain of maxillary sinusitis. You are telling that inferior orbital nerve is a continuation maxillary nerve? Yes. And it is carrying the pain of maxillary sinusitis. Yes, maxillary sinusitis. Not only that, it is also carrying the pain of upper toothache. Upper toothache. So carrying the pain of upper toothache. Then who is carrying the pain of lower teeth? Lower teeth, mandibular nerve. This is actually maxillary teeth. So if this is maxillary teeth, then maxillary nerve. Yes. And if it is mandibular teeth, then mandibular nerve. Yes, that will be lower teeth. But this is upper teeth. Okay. Can I discuss the lower teeth then? Yeah, okay. This is the mandibular nerve, which is a branch of trigeminal nerve to supply the bone mandible, and also mandibular teeth, which is lower teeth. So it will carry the lower toothache. Yes, but remember, mandibular nerve, as it is going to supply the mandible bone, it has to pass through foramen ovale. And as it is passing through foramen ovale, below the foramen ovale, it will be topographically related with the otic ganglion. Now, if the trigeminal nerve, mandibular nerve is topographically related with the otic ganglion, which is the functional nerve, that is the glossopharyngeal nerve, nerve number 9. If the glossopharyngeal nerve is the functional nerve, then which gland it is supposed to supply? The parotid. But to supply the parotid, it requires a topographic nerve, and that will be a branch of the mandibular nerve. So you are telling mandibular nerve is topographically related with the otic ganglion to carry postganglionic fiber towards the parotid gland? Yes, because preganglionic are already carried by glossopharyngeal nerve, the functional nerve. Remember one question which AIIMS people have asked. Which question? They are asking, what is the relation of the otic ganglion to the mandibular nerve? And you tell, relation of the otic ganglion to the mandibular nerve is, otic ganglion is more medial and deeper, and the mandibular nerve is more lateral and superficial. You mean to say, when you are talking about the otic ganglion, the nerve is more lateral and superficial? Yes. And the ganglion is deeper and more medial? Yeah, that is the point. Understand? The relation of otic ganglion to the mandibular nerve. Mandibular nerve is more lateral or superficial, and the ganglion is more deeper or medial. That is one of the AIIMS question. Okay, what is this other ganglion which is under the mandible? This other ganglion, which is under the mandible, is submandible ganglion, controlling the submandible salivary gland. Not only submandible salivary gland, but the sublingual salivary gland also. Do you remember this ganglion? Facial nerve ganglion. So this is submandible ganglion under the mandible, supplying the submandibular salivary gland, and also it is supplying sublingual salivary gland. It is functionally related with facial nerve, and topographically trigeminal, TT, topographic trigeminal. Which branch of trigeminal? That is lingual nerve. Lingual nerve. Lingual nerve, branch of the mandibular nerve, branch of the trigeminal nerve. Yes. If you say lingual nerve is the branch of the mandibular nerve, branch of the trigeminal nerve, it is the topographic nerve to carry postganglionic fiber towards the salivary glands, which are sublingual, submandible salivary gland. Yes, understand. Facial nerve can bring only preganglionic fiber. The postganglionic fiber will be carried by lingual nerve towards the submandible, sublingual salivary gland, which itself is a branch of lingual nerve, is a branch of mandibular nerve, is a branch of trigeminal nerve, and it is topographically related here. Okay, fine. All these ganglia, whichever you have discussed, they are all topographically related with trigeminal, but their functional nerves are different. For the ciliary ganglion, it is oculomotor. For the pterygopalatine and submandible ganglion, it is facial. And for the otic ganglion, it is glossopharyngeal nerve. Functional nerves are different. 3, 7, 9 are functional nerve. Topographic is trigeminal. As you talk more about the branches of maxillary nerve, because there are many questions on that, let us see the details. And you draw the diagram. The diagram will be similar to one which you have seen. Actually, there is a trigeminal ganglion giving the phi 2 maxillary nerve, passing foramen rotundum to have relation with the pterygopalatine ganglion, and then it is giving a branch to the upper molar. Upper molar. What branch to the upper molar? Posterior, superior alveolar nerve, and then it will pass through the inferior orbital fissure, and then it will become inferior orbital nerve and give some more branches to the upper teeth. Which branches to upper teeth? They are called middle and the anterior. You are telling that there is some middle anterior what? They are called as the middle superior alveolar nerve, and then there is anterior superior alveolar nerve, and they supply the anterior teeth, the incisors, canines. This is what we have to discuss. And also remember, these nerves are going to carry the pain of maxillary sinusitis also. Pain of maxillary sinusitis and the pain of upper teeth are carried by the branches of inferior orbital nerve and maxillary nerve. This is what we have discussed earlier. Let's draw the diagram. So you want to discuss trigeminal ganglion now? Yes. Giving 3 branches, and one of them you are following phi 2. Yes. Maxillary nerve. Yes. And what is maxillary nerve doing? Maxillary nerve is supplying the bone maxilla, but before that it has to pass the foramen rotundum. After passing foramen rotundum, it is related to one ganglion which is called as the pterygopalatine ganglion topographically, and then it is giving one branch also which is supplying the upper molar. If it is supplying the upper molars, then what is the name of that branch? See, this is upper molar, so superior alveolar nerve, upper molars. Posterior and superior and alveolar and nerve. Posterior superior alveolar nerve, yes. Then who is giving middle and anterior to supply the upper teeth? That you will see now. You are telling this is the nerve passing inferior orbital fissure, becoming inferior orbital nerve at the floor of the orbit. So you are mentioning now it is at the floor of orbit. Who? Actually, maxillary nerve is continuing as the inferior orbital nerve after passing inferior orbital fissure. So maxillary nerve is passing inferior orbital fissure to become inferior orbital nerve running at the floor of orbit. Yes, and when it is running at the floor of orbit, it will give 2 branches, and they were called as middle and anterior. Middle superior alveolar nerve, yes. Anterior superior alveolar nerve, yes. And supplying anterior teeth, which are incisors, upper incisors, yes, upper incisors, and then giving the supply to the molars. No, not molars, premolars. Premolars, yes, premolars. So you are telling molars are already supplied by posterior, yes, posterior is molar, and which is the middle, the premolar, and which is anterior, the incisor. So anterior incisor, yes. Middle is molar, No, premolar. And posterior molar, upper molar. Yes. Who is supplying lower molar? Lower molar mandibular branches. Okay, this is what you wanted to discuss. Yes, remember, the maxillary nerve is a sensory nerve. If maxillary nerve is sensory nerve, then who is the motor nerve? The mandibular. Let us discuss the mandibular. Actually, mandibular nerve is mixed nerve. What do you mean by mixed nerve? Mixed nerve means it is sensory motor. If you say mixed nerve, sensory motor, then what is it sensory to? What is it motor to? Whatever is related to mandible. What is related to mandible? Muscles of mastication. Muscles of mastication. Yes. Attaching to mandible bone. Yes. And skin on the mandible. Yes. That is mandibular nerve. Yes. Okay, let's discuss the detail then. See, trigeminal ganglion will give you mandibular nerve passing the foramen ovale, and there's a main trunk, and there's an anterior posterior division, and posterior division will give you 3 branches which will have to memorize, and anterior division mostly supply the muscles of mastication. What is the muscle of mastication it is supplying? Tell me. Let us discuss all that now. You have to understand. This is trigeminal ganglion, okay? It is giving us the mandibular nerve, yes. This is the main trunk of mandibular nerve, right? Now, this main trunk of the mandibular nerve, what is it doing? It is supplying a muscle. Which one? It will give a branch to the medial pterygoid. So, main trunk will give a branch to medial pterygoid. Medial pterygoid is a muscle of mastication attaching to the mandible bone. Yes. And what is the nerve doing after that? After that, the nerve is dividing into 2 divisions. What are the 2 divisions? Anterior division and the posterior division. And what is the posterior division doing? Posterior division will give you 3 branches remembered by the mnemonic Ali. What is that? Ali. What is this Ali? What is this Ali? Posterior division will give you Ali branches, A and L and I. So you're telling A, L and I. Yes, Ali branches. Now what is this Ali? What is A for? A is auriculotemporal nerve, which is supplying the auriculotemporal skin. You're telling trigeminal ganglion gave you the mandibular nerve phi 3. Yes, this was main trunk. Main trunk supplied the medial pterygoid, and then it is dividing to anterior posterior division. What is the posterior division doing? It is giving 3 branches, which are Ali branches. What is this Ali branches? You see, A is the auriculotemporal nerve supplying skin on the tragus, auricle, anterior auricle, and temporal skin. And what is the I? I is called as inferior alveolar nerve. If you say it is inferior alveolar nerve, I think inferior alveolar nerve should supply the lower teeth. Yes, lower teeth. It is supplying lower teeth, and it is going to carry the pain of lower teeth. So lower to thick, yes. Carried by the inferior alveolar nerve, yes. There is a superior alveolar nerve, upper teeth pain. Inferior alveolar nerve, lower teeth pain. This inferior alveolar nerve supply 2 muscles also. Which 2 muscles? They are at the floor of the mouth, mylohyoid attaching to the hyoid bone, and one more muscle attaching to hyoid called anterior belly of digastric. But why is it supplying the 2 muscles there? The names are, yes, what are the names? The names are mylohyoid attaching mandible and hyoid bone, and other is anterior belly of digastric attaching mandible bone and hyoid bone. So you're telling inferior alveolar nerve, in addition to supplying sensation of lower teeth, is giving 2 muscle supply. Yes, they are. Mylohyoid muscle attaching mandible bone, hyoid bone, and the anterior belly of digastric. Both are depressor of mandible, helping gravity. So gravity will pull the mandible down. Yes, gravity pull the mandible down, assisted by these 2 muscles to open the mouth. You want to open the mouth? Use the muscles. You mean to say open the mouth, gravity is helping? Yes. And some depressors are helping. But you have not discussed the chief depressor. These are accessory muscle for depression. Now, if these are accessory muscle of depression, then who is the chief muscle of depression? That we'll see. But these are accessory muscles. Mylohyoid and antibody of digastric, supplied by inferior nerve, branch of the mandibular nerve. Trigeminal. Okay, then you told Ali branches. A is auriculotemporal nerve supplying skin. I is inferior nerve supplying some sensation and muscle. What is L for? L, you remember? The topographic nerve. L, the topographic nerve, you mean, oh yes, lingual nerve. Branch of the mandibular trigeminal? Yes. I think this is the topographic nerve which was carrying the postganglionic fiber to supply some salivary glands there. Yes, that lingual nerve, that lingual nerve. It also carry journal sensation. Journal sensation from where? Anterior 2/3 of the tongue. So this is lingual nerve carrying journal sensation from anterior to, okay, developmentally. Yes, developmentally. Anterior 2/3 of tongue develop in first arch. So what is the nerve of first arch? The mandibular trigeminal carrying the journal sensation. Anterior 2/3 of tongue develop in the first pharyngeal arch, and the nerve is mandibular trigeminal, but it carry only the journal sensation. So journal sensation anterior 2/3 of tongue is carried by lingual nerve, branch of the mandibular trigeminal nerve, and it is also carrying postganglionic fiber towards the salivary gland, sublingual, submandible salivary gland. What is the anterior division doing? Anterior division, it will supply the muscles of mastication. Can you tell me what muscles of mastication it is supplying? There are many muscles of mastication it is supplying. Yeah, okay, many, but who are they? We have to discuss them now. If you're telling that the anterior division is supplying muscles of mastication, and who are they? We have to discuss. Let's do that. Remember, muscles of mastication develop in first pharyngeal arch. So they will be supplied with the nerve of the first pharyngeal arch, which is mandibular trigeminal. Mandibular nerve branch of trigeminal. Okay. Actually, mandibular nerve trigeminal will supply 8 muscles. 8 muscles. Why? Because there are 8 muscles developing in the first arch. What are the 8 muscles developing in the first pharyngeal arch supplied by mandibular trigeminal? There are 3 elevators of mandible, and there are 3 depressors of mandible, and there are 2 separate tensor muscles. So you are telling that there are 3 elevator and 3 depressor of mandible, and there are 2 separate tensors. Who are these 2 separate tensors? Actually, they are called tensor tympani to tensor the tympanic membrane, and tensor palati to tensor the palate. You're trying to say that there are 2 separate tensor muscles. One is called tensor tympani to tense the tympanic membrane and reduce the intensity of the sound coming to the inner ear. Yes, it will dampen the sounds. Tensor tympani by tensing the tympanic membrane. And tensor palati, yes, what the tensor palati will do? Tensor palati will tense the palate, but it can also help us to open the eustachian tube. So tensor palati will help us to open the eustachian tube, yes. And also tense the palate, yes. Supplied by, both the tensors are supplied by mandibular nerve, branch of trigeminal nerve. Okay, then what are the 3 elevators? The 3 elevators of mandible, yes. The 3 elevators of mandible are called MTM elevators. What is this MTM elevators? What is this M for? What is that M for? One M is the masseter. And what is the other M? Medial pterygoid. Oh, I remember. Medial pterygoid was supplied by the main trunk of the mandibular nerve. Yes. Then who will supply masseter? Anterior division, of course. So this will be supplied by anterior division. Yes. And this is the main trunk. Yes. And what is the T muscle? T. Temporalis. So T is temporalis. Yes. And it is also elevating the mandible. Yes. Supplied by anterior division, of course. Anterior division of the mandibular nerve, branch of trigeminal nerve. So you are talking about 3 MTM elevators. There is the masseter muscle, there is the temporalis muscle, both supplied by anterior division of the mandibular nerve trigeminal. Yes, because the main trunk was supplying medial pterygoid. Then who are the depressors? You know already. I know already. Which one? You did not discuss the chief depressor, otherwise you know 2 of them already. 2 of them. Who are they? One was the mylohyoid. supplied by inferior alveolar nerve. Remember? The other was anterior belly of digastric, supplied by inferior alveolar nerve, if you remember. You're telling mylohyoid and the anterior belly of digastric supplied by inferior alveolar nerve helped by gravity. Yes, gravity, so that you will depress the mandible to open the mouth. And who is the chief depressor? Chief depressor we did not discuss. Now you discuss lateral pterygoid. So lateral pterygoid is the chief depressor. Who is supplying lateral pterygoid? Of course. Who is supplying lateral pterygoid? Mandibular nerve. Remember, mandibular nerve is the nerve of first arch supplying 8 muscles developing in the arch. What are the 8 muscles? 3 are elevators, MTM elevators of mandible, and 3 are depressors of mandible. Chief depressor, lateral pterygoid, and assisted by mylohyoid, anterior belly digastric. And there are 2 tensors also supplied by mandibular nerve trigeminal. Now we want to focus upon the 6 muscles of mastication, their origin, insertion, and action. You want to discuss the 6 muscles of mastication. Their insertion must be mandible. Why the insertion must be mandible? Because they have to move the mandible, then only there will be mastication. Then what is the origin? If you say they are inserting, if you're telling these 6 muscles of the mastication are inserting on mandible, because mandible is the movement muscle bone, then what is the origin? You have to see the origin then. Yeah, let's do that. Look at the right side of the mandible, or you can look at the entire mandible. So you want to look at the entire mandible? Yes. Then the right side of mandible later? Yes. But here, entire mandible. Where is mandible? I cannot see. This is some lady here. Yes, you have to go deeper. Then you can see. Deeper. What do I see? What you find is that this is called as the head of the mandible. Head of the mandible or condyle? Yeah, condyle or head of the mandible. Then there will be a neck of the mandible and body of the mandible. If that is body of the mandible, then what is this? This is actually called ramus of the mandible. Ramus of the mandible. Oh, what is this anterior structure then? That anterior structure is actually coronoid process. Coronoid process. So you're telling that there is a head or condyle of the mandible? Yes, it will make a condylar synovial joint, temporomandibular joint. So temporomandibular joint is a condylar synovial joint because there's some condyle here? Yes. Okay. What is this? This is coronoid process of mandible. And what is that? This is the ramus of mandible. This is the body of mandible. There you see some mantle foramen also. And what else? You see some pterygoid fossa. What do I have this pterygoid fossa for? For the insertion of the what? The lateral pterygoid muscle. So lateral pterygoid muscle will insert here and pull the neck anterior for protrusion. Yes. Lateral pterygoid will pull the mandible anterior for protrusion. But not only protrusion, it can do depression also. Though depression is basically gravity. So you're telling me the 2 actions of lateral pterygoid now? Yes. Actually, lateral pterygoid is inserting on the pterygoid fovea to pull the mandible anterior. As you pull the mandible anterior, then there will be protrusion of mandible. Yes, that is the chief action. It has a accessory action to depress the mandible and open the mouth, helping gravity to open the mouth. Okay. Can you tell me some more details of the diagram? Yes, you can see here. The other details of the diagram. The masseter muscle is inserted here. Where? On the angle of the mandible. If you say masseter muscle is inserted here on the ramus and angle of mandible, it is laterally attached. It is outside the mandible. So masseter muscle is inserted on the ramus of the mandible, angle of the mandible, and on the lateral side, outer side. What is inserted? Exactly mirror image on the medial side. It is exactly the mirror image on the medial side, and that is the medial pterygoid. Understand? Medial pterygoid is exactly the mirror image of masseter muscle, but masseter muscle is on the outside and the medial pterygoid is inside. Are you trying to say masseter and medial pterygoid, they will sandwich the ramus of the mandible? Yes, because masseter is outside, medial pterygoid is inside, so they will sandwich the ramus of mandible. So masseter is outside lateral, yes, and medial pterygoid is medial, yes, and then they'll sandwich the ramus of mandible in between, yes. Okay, what about the pterygoid phobia you told? Yeah, pterygoid phobia is actually the insertion of the lateral pterygoid muscle. And what is lateral pterygoid doing? It is pulling the mandible anterior, protrusion, and it can also do depression. If you say so, fine. What is this muscle here? Temporalis, inserting into temporalis. It is inserted into the coronoid process. The coronoid process. So this is temporalis. Yes, temporalis, coming from temporal bone. Origin is temporal bone, insertion is coronoid process. Origin temporal bone, insertion. I think it will pull the mandible back. Protraction, not protraction, retraction. Retraction, yes, because protraction is lateral pterygoid. So protraction is lateral pterygoid and protrusion, yes. And retraction is the temporalis muscle, yes. Okay. So temporalis muscle, what is the origin? Temporal bone. What is the insertion? Coronoid process. And pull the mandible back. Protraction? Not protraction, retraction, retraction. Okay, retraction, retraction, fine. This is the insertion? Yes, that is the insertion. Can I see the muscle now? Yes, let us discuss the muscles now. This lady, again, yes, you have to see the muscles. They are deeper to the skin. So deeper to the skin, inserting on mandible. Yes, they are here. You see, this is the temporalis muscle coming from temporal bone. And what is it doing? It will be inserting on the ramus which they have cut. Or they have cut the ramus. Yes. Why did they cut the ramus? To show you some other muscles. Which muscle? This is attaching to ramus externally, laterally, and that will be the masseter. Exactly mirror image on the medial surface will be the medial pterygoid. So you're telling this is some medial pterygoid, but it is on the medial surface of the mandible? Yes. Medial pterygoid. And I think this is a muscle which is pulling the neck of the mandible anterior, the lateral pterygoid. Yes, that is lateral pterygoid pulling the neck of the mandible anterior. Protrusion. Yeah, not only protrusion but also depression. Then temporal is for retraction. Yes, it is for retraction. Then I think MTM muscle for elevation. Yes, MTM for elevation. This is the first M, the masseter. Second M, the medial pterygoid. And third M, it is not MT, MTM. T for temporalis. MTM elevators. But lateral pterygoid is a depressor. You mean to say one muscle antagonizing three muscle? Yes, one muscle antagonizing three muscle. Lateral pterygoid is a depressor antagonizing the MTM elevators. And this is the diagram which we are supposed to draw now. So this is the diagram which we are supposed to draw. What is this? This is the condyle of the mandible, neck of the mandible, and this is the coronoid process, this is the ramus of mandible, the body of mandible, and there is the outer muscle masseter, inner is medial pterygoid, and attaching to pterygoid fovea is lateral pterygoid. This diagram we have to draw. Yes, let's do that. You are looking at mandible here. Yes, mandible. Which part of mandible you are looking at? Mandible, we will tell this is the head of mandible, neck of mandible, and this is coronoid process. What is that? Head of mandible, neck of mandible, and coronoid process. Okay, coronoid process. Then this is the ramus of mandible, body of mandible. Yes. What is attaching there? If you are talking about the temporalis muscle, you will see this is the temporalis muscle which is coming from the temporal bone, and it will insert here, the coronoid process. Doing what? Doing this. What is this? You resolve the vector, you will see. I have to resolve the vector to see? Yes. I think when I resolve the vector, it will be actually a elevator and retractor of mandible. Yes, it is an elevator and it is also a retractor of the mandible, since the temporalis muscle is coming from posterior side. So temporalis muscle is coming from posterior side and pulling the coronoid process of mandible posterior. You are resolving the vector into xy direction. Yes, this is the x direction, this is the y direction. Y is elevation, x is the retraction. Then who is the protraction muscle? Protraction, I tell you. This is pterygoid fovea. This is the muscle. Oh, that is pterygoid fovea in the neck of the mandible, and you are talking about the muscle which is called as lateral pterygoid. Yes, remember, lateral pterygoid insertion is to the pterygoid fovea in the neck region of the mandible, and it is a protruder and depressor. Chief job, protrusion of mandible, and assisting gravity, it is a depressor of mandible to open the mouth. Open the mouth. And what are the other muscles? Other muscles you know already. Actually, there will be one muscle which is on the lateral side of the ramus, and they'll be on the medial side of ramus. So what will they do? They will pull the mandible like this. So if they're pulling the mandible like this, then what are they doing? Elevators. See, what I'm showing is two muscles basically. One will be outside the masseter, and one will be inside the medial pterygoid, and both of them are attaching to ramus of mandible. They actually sandwich the ramus of mandible. So outside masseter, inside the medial pterygoid, but their direction of pull is same. They are elevators. Are you trying to say MTM elevator, the masseter and medial pterygoid? Yes. And temporalis is already told? Yes. So three muscles antagonized by one muscle, which is the protruder, the lateral pterygoid. Yes, this is lateral pterygoid. Antagonizing MTM elevators. One is masseter, one is medial pterygoid. Both have same insertion on the ramus of mandible. What about the other muscles? You were telling there are some two depressors also. Yeah, two depressors. Actually, you have to draw the hyoid bone here. Hyoid bone, yes. Below the mandible bone, yes. Okay, hyoid bone below the mandible bone. Then which muscle? You know, there is a muscle at the floor of the mouth. What is this muscle at the floor of the mouth? It is called as mylohyoid muscle. So mylohyoid muscle, which is at the floor of the mouth. Yes. And what is the other one? Other one, you will see there is a muscle which is, yes, coming from the, yes, mandible to, it is coming from the mandible bone to the hyoid bone. It is coming from mandible bone to hyoid bone. Who is this? It is also going backward towards what is called as the mastoid process of the skull. Mastoid process of the skull. Oh, it has two bellies. Yes. Are you talking about the anterior belly of digastric and the posterior belly of the digastric? Yes. Attaching to hyoid bone here? Yes. And mandible bone and the mastoid bone? Yes, actually. Anterior belly of digastric attaches to mandible bone and the hyoid bone and develop in the first pharyngeal arch and is a depressor of the mandible. Pull the mandible down and open the mouth. Along with mylohyoid, both of them are supplied by mandibular nerve, branch of trigeminal nerve. All these muscles of mastication, 6 muscles of mastication. All these muscles of mastication, 6 muscles of mastication are supplied by mandibular nerve, branch of trigeminal nerve, because they all develop in first arch. But remember, posterior belly of digastric, which is attaching to hyoid bone and the mastoid bone, is developing in second arch. Which nerve will supply? It's a hybrid muscle. It has double nerve supply. If you say it is a hybrid muscle, it has double nerve supply, then posterior belly of digastric, which develop in the second pharyngeal arch, will be supplied by a nerve of the second arch, which is facial nerve. So this muscle is supplied by facial nerve posteriorly and the mandibular nerve trigeminal anteriorly. Yes, anterior belly, mandibular trigeminal, posterior belly, facial nerve, making the muscle hybrid muscle, a muscle with more than one motor supply. Muscle with more than one motor supply is hybrid muscle. Okay. Is that over? Yes, that is over. Just quickly revise. What? Who is elevating the mandible? Elevating the mandible, I know. M, T, M elevators. If you say M, T, M elevators, fine. Then who is depressing the mandible? Depression, gravity. But gravity is assisted by lateral pterygoid. And what else? It is assisted by accessory muscle. Who is the accessory muscle? Suprahyoid. We have discussed. Which suprahyoid you have discussed? Actually, we have discussed anterior belly of digastric along with the mylohyoid muscle. So, they are suprahyoid above the hyoid bone. Yes, they are depressor of mandible to open the mouth. And what about the protrusion? Protrusion, chief protruder. Lateral pterygoid. So, chief protruder is lateral pterygoid? Yes. And what is masseter, medial pterygoid doing? They are accessory muscles of protrusion. Yes, accessory muscle of protrusion, but chief muscle is lateral pterygoid for protrusion. And what is the retrusion? You mean to say retraction? Yes. Temporalis. Temporalis is retractor. It is behind. It will pull the mandible behind. And masseter? Masseter, some books will say masseter is assisting temporalis. But remember, when you say masseter medial pterygoid, their chief job is elevator of mandible. Their chief job is elevation of mandible. Maybe they have some accessory activities, but chief job is elevation of mandible. You mean to say chief protruder is lateral pterygoid? Yes. Chief retractor is temporalis? Yes, that's the point. Okay, fine. What about the lateral movements? What is lateral movement? Grinding movement. Grinding. What is grinding? Have you seen a buffalo chewing the cud? Grinding. Oh, we are buffalo-like movement. Yes, you have buffalo-like movement. How do you are doing that? Actually, understand, pterygoids, they are helping for side to side movement, grinding movement. And remember, lateral pterygoid muscles are pulling the mandible anteromedial. You mean to say protrusion in the midline? Yes, and depression also. They aim the mandible. You are telling that lateral pterygoid, yes, will aim the mandible. A-I-M, aim the mandible. Take the mandible anterior? Yes. Take the mandible inferior? Yes. Take the mandible medial? Yes. Aim the mandible. Lateral pterygoid muscle will aim the mandible. What is that? Take the mandible anterior and inferior, depressor and medial. So what will happen if one of them is not working? Which one? Right. Right lateral pterygoid is not working? No. See, normally they balance each other. Medial vector cancelled. Normally they balance each other, medial vector cancelled. And what if one of the muscle not working? Then the other is more powerful. You mean to say right trigeminal nerve palsy? Yes. Right lateral pterygoid not working? Yes. Then left lateral pterygoid is more powerful and pull the mandible medial, and mandible deviate to same side of lesion. The mandible jaw will deviate to same side of lesion. Yes. Can you show that in some diagram? Yes. There will be atrophy of muscles. Which muscle? The muscles of mastication, and the jaw will deviate to same side of lesion. Why? Because the other lateral pterygoid is unopposed, more powerful. Normally the lateral pterygoid balance each other, medial cancelled. But if one medial is not working, one lateral pterygoid is not working, other is more powerful. This, yes, this is right-sided trigeminal not working, right-sided atrophy of muscle, lateral pterygoid not balancing, the lateral pterygoid of left side more powerful. Keep pulling mandible midline, cross the midline and deviate to the same side of lesion. Due to lateral pterygoid? Yes. Okay. What else will be the problem? If the trigeminal nerve damage? Yes. First of all, trigeminal nerve comes from the pons and it is sensory motor nerve. The mandibular nerve is a mixed nerve supplying muscles of mastication and sensation. Also, where? On the skin on the mandible and tongue anterior 2/3. So, whenever mandibular nerve is gone, what will happen? You see, the muscles of mastication will be compromised and sensory loss depending upon which area involved. If it is the tip of nose, ophthalmic, if skin of the maxilla, then it is maxillary nerve, and here it is mandibular nerve. Sensory loss on the tongue, anterior 2/3 of tongue also, general sensation lost if mandibular nerve is involved.